Hello, everyone. Thanks for joining us today for the next presentation in our series of webinar forums on managing stress. This is a joint production of the Department of Psychiatry, the University of Iowa Hospitals and Clinics COPE team, and the University of Iowa Employee Assistance Program. I'm your facilitator, Dr. Laura Fuller from the Department of Psychiatry. I have important information to share about this program. This webinar is provided for educational and informational purposes only and does not constitute providing medical advice or professional services. If you think you may have a medical emergency, call 911 or go to the nearest emergency room. No provider-patient relationship is created by this webinar or its use. Neither the University of Iowa nor its employees nor any contributor to this webinar makes any representations or warranties expressed or implied with respect to information provided herein or to its use. Now that I've said that, I want to tell you how excited we are that you've joined us today. If you are watching the live stream version of this program, there will be time for a limited number of questions at the end of the presentation. Please use the chat function to submit questions. A recording of this webinar and further resources will be available at the Loop on the hospital website. Our presenter today is Dr. Karla Hemesath, Clinical Associate Professor in the Department of Family Medicine. The topic for today is recognizing and intervening when someone needs support. During her presentation, Dr. Hemesath will draw on her extensive therapeutic expertise and work in academic medical centers to help us support those around us during the time of COVID-19. Here to tell you more without further ado, Dr. Hemesath.
Oh, good afternoon. Thank you, Dr. Fuller, and welcome. I'm glad you're joining us. As you can see, I'm in my spacious palatial office at Iowa River Landing at Family Medicine. So we're glad you're here. So today's topic is one that's going to be a little bit more focused on some of the struggles that we see with the current situations that we're experiencing. We've had many wonderful talks that have focused on resilience and helping people manage and working on things. And today we're going to focus a little bit on looking for challenging areas and supporting ourselves as well as our coworkers. So I think I'd like to give a little bit of background on why stress is such a multifaceted thing. For many of us, we've probably participated in numerous biology and physiology courses, as well as neuroscience and a variety of things that give us a detailed understanding of how our bodies work and respond to stressors. But basically, when we're stressed, our physiologic responses start to trigger our fight or flight response. And so some of the symptoms of stress are really grounded in that basic biology. So I think it's important to understand that while we're stressed, our bodies respond in a variety of different ways, and we'll talk through some of those. And many of those are normal physiologic reactions to very unprecedented and significant stressors. So I think one of the things I'd like to talk about before we talk about the different reactions is acute versus chronic stress. As healthcare providers and people that work in healthcare, we are not strangers to stress. We work in fast-paced environments. We work with very sick people. We work in challenging situations. And so most of us are very resilient and adept at moving from situation to situation. When we have a stress like this current pandemic, it is not only a very acute stressor because it happened fairly rapidly over a short period of time, but it also has an element of chronicity or length to it that can make it challenging as well. I think in the patients that I've worked with, and one of the pleasures of my job is the incredible people that I get to meet and the strengths and the gifts that I get to witness. So I'm very fortunate. But many people, we are attuned to those very acute stressors, but also the dangers of this longer term open-ended stress. Things are opening up and we have to do them pragmatically and realistically, and we're not sure, when things will return to a semblance of normal, and normal will be different. So we have we're challenging with those very acute things on top of some longer term stress. So stress kind of happens in a variety of different ways. So in looking at my own level of stress, my coworkers' stresses, of which I might be a part sometimes, our patient stressors, we want to look at a variety of different things. I think a helpful frame, and you will see this in the resources that I present, and those will be posted at the end, is kind of a stress continuum model. And this was developed by the military, so the Navy, the Marines, the Army, and has been adopted widely throughout high stress professions such as law enforcement, public safety, and healthcare. And it really kind of looks at stages of people's stress responses. So that will be a helpful graphic to give you a picture of, it's very color coded. So there's green, there's yellow, orange, and red, and you'll see that at the end. But when we think about stress responses, I think of four big buckets. So we have physical stress responses, behavioral stress responses, so ways we act, cognitive, which are the ways we think about things, and emotional responses, so the ways our emotions might be changing or being responsible, and varying from situation to situation. And so it just helps me kind of categorize them. I like categories and I like lists, and probably sometimes too much, but I think it does help to frame what is normal versus what might be more problematic. So I'm going to delve a little bit into some of those things. We are seeing a lot of physical signs. So we think about our stress response and our body's reaction to stressful events, and our sympathetic nervous system kicks in. So we have stress hormones that are coursing through our bloodstream, and those are very good and they're very protective, but too much exposure to those can really generate some of those more physical symptoms that we experience. So things like headaches, nausea, stomach aches, vomiting, fatigue, dizziness, chills, chest pain, rapid heart rate. I don't want to say that there aren't medical reasons for those, but those are some physical indicators of stress. And those are things that can be very frightening when we experience them, because our brains may not connect the fact that we're undergoing a lot of stress and this might be a stress reaction. And so our bodies will often sound an alarm. And those are things to watch for. And yes, we don't want to rule out medical issues or very serious conditions, but those can be very strong signs of stress as well. So some of the emotional bucket, things like worry. I think many of us are worried for a variety of different reasons. Worry can be very, we can worry about many things, or we can have very strong worries about things, but worry is certainly on the first and foremost of the list. Difficulty controlling that worry. I think when worry gets out of hand and we are not able to corral it, it can be very challenging. I think worry can have a very functional thing, but when it is difficult to corral and contain it, and we worry about lots of different things, then it can be a real sign of stress and struggle. One thing that I am seeing both personally and I think in some of the patients and coworkers is some issues with irritability and snappishness. Maybe not full anger, but I think many of us are on edge, and that comes from working in fast-paced or maybe not so fast-paced environments, not sure of what's going on, but that can put many of us on edge. And it makes it very challenging at times to respond like we normally would. So sometimes when someone might seem shorter, or they may send an email that's a little bit more pointed, we're just seeing more of that. And I have patients that are talking about that as well, as, my fuse is just shorter, or my family's driving me insane. Not literally, but I think many of us are not used to spending as much close time together, and that close time can be also challenging because we really enjoy routines, and I think we need routines. So when we spend a lot of time with people, it can be a good thing, and it can also be stressful. Guilt. I think guilt is a very, it can be helpful. But it can also be very challenging because I think it's overwhelming for people. And when guilt overwhelms kind of our sense of reason, that can keep us very stuck also. Some people are going to be more tearful and sad. Some of us, when we're anxious, we tend to be more tearful. There's a lot of grief. I have a nephew who's a high school senior, and he's a very laid back young man, but my heart hurts for him when I think about some of the things he's missing. He wasn't too upset about prom because he wasn't going to go, but last night he had a virtual awards ceremony, and while it was really neat and his school did a beautiful job and it was wonderful, it is sad to think about some of those milestones that we're going to miss, that people will miss. And we miss each other. We miss routine. I think fear, many of us can be afraid. Fear is a little bit different than worry. Fear is kind of, worry can be being concerned. I think fear is kind of an extra added dimension. And I think there's a lot of us that are struggling with mood swings and feelings of hopelessness and helplessness. I think many of us want to help. We're designed to help. We're here in health professions to help. And it's sometimes hard when there may or may not be enough for us to do, or there's too much to do, or the things that we're not used to doing. So some cognitive things, or cognitive means thinking. So some of the things that I encourage people to look and consider, I do a lot of what's called cognitive behavioral therapy. So it really focuses on how we think about things and how we appraise activities. And so some of the founders of cognitive behavioral therapy have talked about something called stinking thinking or automatic negative thoughts. But there are times when, it's easy to get stuck into a mode of catastrophization. I joke, and I'm very fortunate for my upbringing, but I grew up on an Iowa farm with an Iowa farmer for a father. And so he's very realistic and pragmatic, but can also be pretty negative. And, given the nature of his work, and he's changed over the years, but sometimes people can catastrophize. So it's easy to think, oh my God, this is not what I was expecting. And so it can be very overwhelming. Some of that's very normal, but when we get stuck in those spots is a time to be concerned. People can be very all or nothing thinking. Something can be fabulous or it can be terrible. And that contributes to mood swings. So you just want to watch for some of those thinking traps. Some of us are really having a hard time concentrating. Some of that can be due to just the change in routine, different workspaces, different work processes. But if you're noticing problems with concentration and memory that persist, those are some things to think about. One thing that I do want to caution people about is for those of you who have a little bit of an agricultural background, you'll understand the term rumination. And so rumination is basically bovine nutrition, or how cows digest their food. But when we ruminate, we tend to rethink about things, and we may go through thoughts repetitively without much forward motion. And so sometimes when something gets stuck in our heads, we can think of it over and over and over, and it can be very distressing. And so that's a sign that I want people to watch for too. Some of it's normal, and a lot of times it goes away. But when you notice that those things don't move, when you're not able to move on, or you notice someone else that's not able to move on, that might be a sign that there's some things that might need to be addressed. And then the last bucket is our behavioral things. So those are the actions we observe. We work in healthcare. There is always work to do. Maybe not the work that we're supposed to do, but I think many of us feel like, okay, there's more we should be doing. And so we will find people overworking. There are going to be people that will underwork. Absenteeism is a challenge too. I think there are people that might be scared to come to work, which is a normal reaction. But I think overworking and absenteeism are things to consider. Sometimes we can be impulsive. I think when we're scared and we're kind of on edge, when we're anxious, it's easy to probably say or do things that we may or may not have done if we were more calm. So that's something to watch, particularly when it involves risky behaviors, things like spending, things like drinking, eating, taking risks that are dangerous, I think is something to watch for. One thing I would caution us to watch for with our colleagues and family members is withdrawing. I think one of the challenges of this current situation is the fact that it is incredibly stressful, and we also are not able to do many of the things that bring us joy. There are a lot of things that we can do that bring us joy. We can do them a little bit differently, but those things that I know for me, just being the freedom of being able to go out and about is something that I really crave, and not being able to do that has been good for me, but it also is a challenge. And so I think withdrawal is a big issue. One thing I do want to mention is that people will tend to drink or use drugs a little. Some people are, some people are not. Some of that is normal, but watching how much, and if it starts to develop into, problems with absenteeism and conflicts and fights, it's definitely something to which we should pay attention and maybe intervene sooner rather than later. Some of it may revert, but it does open up a pathway of risky behaviors and choices. I think one thing I'm also seeing is a little bit more relationship conflict. I'm a couples therapist by training, and I do some couples work, and I know that many of my individual patients are kind of expressing some a few challenges. And that doesn't mean there's problems in the relationship. It means that we're under stress. But when those things predominate, it's probably important to pay attention. One thing I do want to mention quickly is the concept of secondary trauma. Because we work in healthcare, we work in a very stressful environment, some more than others, and it is not uncommon for healthcare professionals and people that work in healthcare to experience stressors that are related to the stressors that we see in our patients and in our coworkers. And so sometimes those things happen just because of acute events, but that's something to pay attention to, particularly now. We can witness some very traumatic things, and we take that with us. We may experience some bad dreams or nightmares. We might have some of those physical symptoms that I've identified. And so the concept of secondary stress and trauma is something that I just wanted to mention. So we are in healthcare. We want to help people. We are usually very outward focused, so it's hard for us to ask for help. And I think being a native Midwesterner, and I know Midwesterners do not have the corner on this, but as a stoic Iowa farm person, or used to be a farm person, it's kind of hard to ask for help when we need it. We may not realize we need help. And so sometimes I have my niece, when she was growing up, used to say, do it self, before she learned about pronouns and conjunctions and a variety of their grammatical tools. But I think many of us have that do it self idea. I think it's hard to ask for help. There's stigma. Certainly many of us who grew up in small towns or close by areas, and small towns don't have the market on this, but we're afraid. What will people think? Does this mean I'm not good at what I do? What will this mean? Will somebody think less of me or think less of my abilities? One thing I do want to strongly emphasize is the fact that much of this is normal reactions to very abnormal circumstances. It doesn't feel good. It is challenging, but these are normal reactions. Many of us have pride. We take which is a wonderful thing. We are very proud of what we do, and we should be. And it is one of the silver linings in all this for me is just the incredible gratitude and the strength that I see in my coworkers and in our patients. And it just really is a very powerful thing, but pride can also be a barrier to us seeking help and to reaching out. We might be embarrassed. I think many of us, just would rather things go normally and not need help, but don't let those things stand in the way. So when should we intervene? I think it's important to remember that many of these things are transient. They're fairly normal. I think my rule of thumb for intervening is when they seem to last and that they're persistent. Sometimes people will have intrusive thoughts. They may have difficulty sleeping. Sometimes people will have flashbacks. I've talked with several colleagues that have had painful things that they remember. They might be patient care situations. They may be other things. So that's sometimes a marker that we need to intervene. Hyperarousal, when we're agitated and irritable and it's hard to self-soothe and calm down. If that persists, that's also a sign. Some of us may numb. We may want to block out some of those thoughts. We may drink more, eat more, do more compulsive behaviors. So if you're noticing those things, might be something important to imagine or to talk with someone about. When our daily routine and functioning is impacted, I think many of us are, going through our trials of trying to work in different environments, in different settings. But when those things really start to impact our ability to get things done and to live the life that we're trying to live, that's when we really should intervene. So we are Midwesterners. I think all of us are polite, and most of us, to bring these things up to someone is something that we want to be very careful about, and many of us do not want to hurt someone's feelings. So I'm going to talk a little bit now about when you notice those things, like how do you have that conversation? So I just want to say that no matter how we say something, I mean, yes, there are things we can do to be careful and to be respectful and to be sensitive and to be wise. But no matter how carefully we say something, we may not always be able to control the other person's reaction. So we can do our best part, but one thing is don't let someone's anger or frustration be a deterrent to saying something. So just having kind of put that out there. Having a conversation, a lot of it is about timing. Sometimes picking the right time. And when a family member, or certainly those of us with spouses and partners and close people in our lives, know when is a good time versus when is not so good time. Pardon my grammar. But picking the right place and the time, and where it's quiet, where you can have some privacy if you're going to do this with a colleague or a coworker or someone, or even a family member. Just being sensitive to the surroundings. A casual conversation. I think most of us get anxious when we think about talking about stuff like this, and so we want to do it right away. It's kind of like, oh, I just want to get this done so I can move on to the next thing. Well, that's probably not the best way to do it. Maybe starting to break the ice with someone and chatting. A lot of times finding the right way to check in on people. It may be a direct conversation. Sometimes it might be an email, a text. Paging can be a little disruptive because people, if their pager goes off and they're like, why is this person paging me? But use your wisdom and your knowledge of the person to kind of guide, what might be the best way to approach this? And sometimes it will take more than one conversation. That's the challenging part of it, because many of us, it's kind of like, oh, I just want to do this once and get the uncomfortableness out of the way. But it is important to kind of think about ways that you can periodically check in, because most of us take a while to process. And so things like this can be challenging, and we may need a little bit of time. So one mnemonic or kind of a guideline I use is called OSCAR. It's OSCAR. So the O is observe. And I think many of us, because we're in healthcare, our powers of observation are very, 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 very well honed, and we can use those to our advantage. Sometimes our people in our lives would wish we'd observe less, but in this case, it's a very helpful, and it usually is a very helpful thing. Just stating, hey, it's been really tough lately. I know it's been hard working at the door or doing the screening, or, I know this is tough. How are you doing? Or how are things going? And using your own language. But that observation is really important. So the S is stating your observations. So, I've noticed you seem more quiet, or I noticed, you seem like you're preoccupied. You doing okay? How are things at home? Just stating those observations. I think that particularly when we are bringing things to loved ones, using behaviors and specific examples can be helpful. It can also cause some stress, but I think making that statement, well, I've observed this. Are you doing okay? Or I've noticed this. Clarifying our role, I think, is important. So that's the C. We are doing this because we care. We are doing this not because we're nosy and we want to bust somebody or get them in trouble. We genuinely care about each other, and I think that's what makes us such a good team. So clarifying, asking why, getting their perspective. Have you noticed anything? What do you think might be going on? And then the R is responding, and that might be, hey, can I check in with you again? Or do you want me to go to HR, go help you find somebody to talk to? So ask her. One thing that we're going to face is that people might be angry in the short term, but our longer term well-being is more important. So if anything, just trying to make sure that we can, most people are going to be very grateful for this. They may not thank you immediately. They're not going to, with social distancing or physical distancing, probably embrace you and wholeheartedly hug you. But I do think that if you're concerned, say something, because I think the short-term discomfort is worth the longer-term payoff, both for ourselves and for the people with whom we're intervening. I just want to talk a little bit about safety. If you notice things with a coworker or a family member and you're worried, pay attention to that. Don't be afraid to ask. Certainly warning signs. We have heard of some self-harm and some suicide in parts of the country that have had a really bad experience, and the depth of the experience does not mean the depth of the response. So I just want to say, if you hear someone that's talking about feeling hopeless, or I'd be better off dead, or they have access to firearms and they seem like they're in danger, talk to them, talk to a supervisor, talk to your HR representative. We have resources at the end. There's our university EAP is a wonderful resource, and they can usually very quickly get people in, and they're a wonderful resource. If you're really worried about someone's immediate safety, talk to your supervisor. You can someone can walk them to the ER. I don't want to panic, but I also think it's important just to know what resources we have. There's a crisis number that the number will be posted as well. So there's some options. We do have the 24-hour, 7-day-a-week confidential employee line. The number for that is posted. So we do have many resources. Your primary care physician is always a wonderful place to start. We are not alone, and you are not alone. So I hope this gives you a little bit of normalcy and an understanding. And thank you. Thank you for being wonderful colleagues and for being such great professionals. So with that.
All right. Thank you, Dr. Hemesath. That was wonderful. It's a very important topic, and something that sometimes people are a little bit afraid to talk about. I have just a couple questions for you. One was, I'll put you on the spot a little bit here. If I were a colleague of yours, which I am, but if you were starting to notice that I was sending you emails that sounded really hopeless, and I was not my normal self, and maybe I was talking about doing less healthy things in my lifestyle, what kinds of things might you say to me if you felt comfortable and you felt like the relationship would bear it?
Oh, well, that is an excellent question. I wish there were a nice, simple answer. I think one of the things would be, depending on the strength of the relationship, is probably to find out a little bit more about what the person's circumstances are, what they might be thinking about. I think probably trying to appreciate where they're coming from, but also, maybe saying, oh, these, it sounds like you might be pretty stressed. Do you want to talk about it? These might be dangerous things. I know that sometimes that can not be the most appreciated response, but I do think noticing and saying something, it's, that could be that observation piece of it. And then offering support. And then if you're really concerned, maybe pulling in a coworker, a supervisor, or if you know a family member. Yes, I think making that connection and kind of identifying those things as being perhaps problematic.
Thank you. I know that there are so many variables, and it feels like it's tricky situation. Not everyone feels like they could manage a conversation like
Right.
that, and that's totally up to people. But I would say that if it were me or a loved one of mine, maybe in the short term, there would be some pushback, but
Mhm.
in the long term, people would really mostly appreciate
Yeah.
someone's well-meaning care and concern.
Yeah. It is tough because I think it's hard. It's hard to know.
Yeah. So one more question. I really liked how you took us through all of the ideas or ways to spot people who are having difficulty, and the ways that we can have difficulty in our thinking and in our emotions and in our physical health, and how those things might show up. Um, I really liked the notion of stinking thinking that you brought up, and I wondered if you could just give a couple examples that people in healthcare or people in our place of work might especially be showing right now.
That's an excellent question. I think it. I think it depends on the work setting. I think where I have seen it manifest, where I particularly manifest is I think that many people feel very, I don't want to say hopeless, but I think that it is very hard to see positives. And that is one of the challenges is when we're facing something like this with significant economic implications for many people, for many health implications, it is trying to, I think just that despair of like, is this going to get better? When is it going to get better? Are the things that we're doing, and just the powerlessness that many of us feel, I think is challenging. And it's hard to feel, I think it just feels like there's so much out of our control. And I do see people kind of getting stuck in that, like, well, it's not going to change, and my summer will be ruined. And, and those are minor things. And I just had a patient this morning who was furloughed and got a furlough notice. So I think that I see a lot of difficulty in kind of seeing the end or some hope. I also see people who are angry. I think people often feel, and I don't think that they're angry in a mean or deliberate way, but I do think that anger is a sign of anxiety and fear. And I think people feel that there's very little personally that we can control. And I think that can be overwhelming. And I do see people that become very frustrated with public leaders, work leaders. And I think that can be something too. That's the danger of stinking thinking is that it's pretty catchy and it's hard to eradicate. And so when those things start to be a predominant theme is when we should probably intervene. I think I do also see people who get who catastrophize, and it is very easy because there's so many things that are outside of our control that it's easy to think, oh my God, I can't deal with this. So those would be the three big things that I see. I'm sure there's many, many others that others see as well.
Yes, and those were great examples. I think we've all been there these days, and I appreciate you mentioning them. So we're going to wrap up now. Thank you very much, Dr. Hemesath.
Great. Thank you.
We appreciate you sharing practical steps we can take to respond to the coronavirus. A recording of today's live stream, as well as links to additional resources related to this topic, will be included on the loop later today. Next time, we'll be joined by Dr. Arwa Abarizek, who will be discussing employee and provider distress. Until then, take care, and we look forward to seeing you soon.
Thanks.